Nora. I'm a dermatologist in Bertam. How many of you know what is eczema?
Eczema is a disease that gives you a chronic inflammation of your skin. It also called as atopic dermatitis. You get an insanely itchy skin rash which is triggered by allergens or irritants in the environment. To help defend our body, the white blood cell tries to fight the allergens off by releasing powerful natural chemicals called as histamines, prostaglandins, and leukotrienes. But during eczema, the white blood cells confuse harmless allergens with harmful ones. The causes of eczema are divided into two major factors, which is the internal and external factors. For internal factors, eczema comes from the inheritance of allergic reaction from the parent, not specifically eczema disease. Eczema also may be caused by stress or psychological effect, which then could affect hormonal balance. Meanwhile, from the external factor, the exposure of allergen to sensitive skin could also trigger eczema. Rough clothing could make the skin lose its barrier, thus exposing the bare skin to skin infections. Irritating substances that present in the soap and certain foods could also trigger eczema development. The sign and symptom that can be seen on children and infants having eczema is the affected skin gets darkened or even lightened, while it also thickens over time. Usually, the rashes would begin in the creases of elbow or knees. The patient will experience extremely itchy on the affected part. Meanwhile, the adults will experience much similar symptoms, except that the aged person could get extreme dry skin as they could not produce enough collagen fiber as they get older.
For the treatment, we can use anti-inflammatory medication such as hydrocortisone, antihistamines, and corticosteroids. Moreover, usually the doctor will use immunosuppressant to slow down the immune response and give us prescribed moisturizers. For serious cases, the patient usually undergoes UV light therapy to cure the disease. Besides, for the lifestyle, we can use mild soap and regularly apply moisturizer. Furthermore, the patient is recommended to take short and warm bath. Other than that, in order to reduce stress, they should go for exercise. Lastly, they should avoid allergic-causing foods as it could affect the disease development. Ways of prevention. In terms of lifestyle, identify and avoid triggers that worsen the inflammation. Secondly, use specialized soaps or synthetic detergents. Thirdly, use skin moisturizers and take a warm bath instead. Next, in terms of taking food, we should avoid high glycemic foods and soy products. Other than that, trying to avoid dairy products, especially from cows, and remove strong acid producing foods. Lastly, avoid to eat bread which is containing yeast.